This is Dr. Malak from Bambini Pediatrics. And April is traditionally the peak month of the year in my experience for seeing chickenpox. That was particularly the case years back before the vaccine. It was very seasonal. Last few years, not so much so. But this year, starting back around 6 weeks ago, we started seeing quite a bit of activity, particularly in the northern part of Dutchess County, homeschool community. A couple kids have been bad enough to get treated with Zovirax, an antibiotic, to take the edge off chickenpox. And you know, this is 21st century. We have social media, Twitter, Facebook, and these parents, we respect them. They're very bright, and many of them want to see their elementary school age children that are in fairly good health get chickenpox before they enter puberty and can start to be at increased risk for complications. For those of you that maybe haven't seen chickenpox in a while, this is what it looks like, classically called dewdrops on rose petals. We hope that especially fair-skinned little kitties are going to see these small ones, not the big angry ones, but sometimes we get a little bit of both. You can get chickenpox on the eyeball, on the eardrum, on the throat. In a mild case, that's not going to happen, but it can. We do see some secondary complications of chickenpox. The most common ones are bacterial infections. April also happens to be the peak month of the year for strep throat. Same germ can cause skin infections. Usually those are mild, but they can get angry. It's sort of a form of impetigo called erysipelas. And then there's also staph, regular skin germs, but even MRSA. I haven't seen that one yet, but we do see MRSA, but more so in the summer, but that's going to happen one of these days. Years ago, we used to see a fair bit of post-infectious ataxia or dizziness from chickenpox. I haven't seen that in a while. And one thing I've never seen, although a doctor in training, when I was a resident, got varicella pneumonia. He was on chemo for lymphoma, didn't do well with it. So that's a kind of an adult complication, not good. What increases the risks of a complication from chickenpox? Well, kids with dry skin or eczema, they probably do better with the vaccine than getting the disease. Just not worth it. Kids that have been run down, maybe had some ear infections, the stomach virus, they've got Crohn's disease or some other, challenge, diabetes, they're not going to do so well with chickenpox. Kids that have already entered puberty, over age 12, are going to have a harder time, as was mentioned, with chickenpox. And then kids that get exposed by a sibling are going to have they're going to have a more intense exposure and have a more severe case than, say, someone that attends a chickenpox party or gets exposed from a classmate in school or daycare. One final word, this is almost a joke. I saw this on WebMD a little while ago. It's a study that came out in December. It says chickenpox vaccine not responsible for the rise in shingles. Well, since the chickenpox vaccine came out about 18-20 years ago, there's been this 39% increase in shingles, and we're seeing that in the office. It's on the rise even in kids. But the doctors say, well, the cause is unknown. It's just not from the vaccine. Well, WebMD is underwritten by Merck and other pharmaceuticals, so I think parents and doctors really that are thoughtful are going to have to make their own judgment on that. But, speculation is interesting. All right, well, thanks for listening, and I appreciate your attention.